Good day, healthcare world builders. I want to talk to you really quickly about scalability and what makes these businesses work. A lot of people are jumping on these businesses because it seems like a fad, right? Start a home health agency, start a group home, start a mental health, behavioral health clinic, start a staffing agency, start an NEMT business. And I realize these businesses require real work, real focus, real intention. And the money is not going to just fall from the sky. The clients are not going to just fall from the sky. So many of you are stuck at scalability, and you're debating private pay versus Medicaid versus VA waiver, etc. And I'm saying that you should include all of it. It takes no more than 45 days for me to get the license on your wall. And it should take no longer for you as well if you know what you're doing. 45 days in, you're already a business, ready to do business, but you can only accept private pay at that point. I have a system. I can show you screenshots where I got over 30 leads in for private pay in under 2 weeks. This is not including the fact that I also know how to, effectively use platforms like A Place for Mom. People say beware and run from it, but the reality is if you know what you're doing and know how to filter it properly, you can even monetize platforms like that as well. I say always go for the lowest hanging fruit. Start with private pay. It's not difficult to get private pay clients, but this business is still about relationships. You have to know how to leverage technology, social media, etc. But you also have to know how to build old-fashioned relationships with caseworkers, discharge planners, care coordinators, right? Various hospitals, various nursing homes or facilities. All of those places that can be a referral source, especially rehab centers where they're transitioning from out of there and back into their home. I have a Rolodex of great relationships, and if you don't have at least 5 good referral sources, then you don't yet have a business. But again, when you talk about scalability, you want to always make sure that you focus on lowest hanging fruit, which is private pay, but always integrate Medicaid with the intention of doing that, and also credentialing, because again, the money and scalability comes from that. If you sit here and you billing for a Medicaid client in Texas right now, that's a little over $20 that you can bill Medicaid. Even if you're paying your caregiver a higher end $15, which again the starting rate is $13. Let's say you're paying them $15. You're getting $5 in your agency per hour, right? Now let's say you turn around and the client needs 8 hours of care 7 days a week. So you do the math on that and you come out to, let's just do it, 8 hours of care times $5, $40. Don't sound like a lot. Now let's do that $40 times 7 days a week, and we had $280 that we made for one client. Now let's do that $280 times, can we just do 52 weeks? And we made over $14,000 for one client. Now you multiply this times, let's say you get 40 clients in the door, and you have made over $500,000 in your agency, almost $600,000 from 40 clients billing Medicaid. So again, most people do well in this business by creating a hybrid. They do private pay and also Medicaid. Medicaid has its own separate contracts. There are 2 contracts, which is 3 and 1 in each one. I also can show you how to get those contracts with the state, and through those contracts, you're billing Medicaid directly. You don't even have to worry about the other HMOs like Blue Cross Blue Shield, Humana, Texas Children, United Healthcare, etc. Even though it's still important to get a network with them as well. I can show you screenshots where we've gotten 30 clients or better, 30 or 40 clients in since January from really just 2 major referral sources. So understand that scalability means this: build referral relationships, which means you need to understand how to have at least 5 good referral sources. Understanding that you should always work on a hybrid model. Start with the lowest hanging fruit, which is your private pay, and then you can do it. And you can be doing that business in 45 days. Outside of that, You want to now add Medicaid, the VA, and your HMOs, and now that's where the scalability comes in. Don't always think about it's not paying enough. I'm only getting this much per hour. If you understood scalability, you understand that much per hour, which is still money on the table that you're leaving if you only want to focus on private pay only, can get you $600,000 in your business by the end of the year with 40 clients. So again, if the math is mathing, then you need to understand that the math is mathing, right? Don't let these so-called gurus talk you out of, getting into Medicaid and other things because they're saying that it doesn't pay well enough. And I know it's state by state based as well, but I haven't seen any state where you can monetize it and make it feasible and make it work. So again, that's your tip for the day: scalability, getting into the money, understanding how to create hybrid models, and also understanding that at the end of the day, if you don't have at least 5 good referral sources, you don't really have a business yet. See you on the next one, Healthcare Well Builders.